And people who were depressed and had short telomeres, if they had bladder cancer, they had an increased risk of mortality, threefold. So they were 3 times greater risk of dying from bladder cancer if you had depression and short telomeres. The researchers also pointed out the data from the study that showed that smoking cessation, weight loss, and increased physical activity slowed telomere shortening and potentially improved the survival rate of those with bladder cancer. So people with bladder cancer, if they had short telomeres, if they lost weight, if they exercised, if they stopped smoking, the telomeres started to lengthen and the mortality went down. They're associated with mood disorders, okay? Depression and bipolar disorders, Alzheimer's disease, dementia, Parkinson's disease. All these neurological, all these brain disorders are related to and associated with short telomeres. So, what can we do? We'll talk about some of the things. It turns out that yoga, simple yoga, is associated with increasing telomere length. A 3 times greater risk. So short telomeres dramatically affect your risk for heart disease. So besides doing all the things that you've learned, and that may be talked about this week, about lowering risk of heart disease, I'm proposing that one thing to be really aware of is how do we reduce the shortening of the telomeres as a way also of reducing the risk of heart disease. And it turns out, now many of you use various lab measurements to talk about someone's health and future problems of the heart. You measure cholesterol, you measure CRP, C-reactive protein, you measure ApoA1, ApoB, LPA, LDL, triglycerides, I'm sure. It turns out that, as this shows here, that telomere measurements are as good or better a marker in predicting future coronary events than LDL cholesterol or C-reactive protein. So the common tests that are being used now to help us work with the patient, motivate them to make changes, or in some cases to take a drug, to reduce their risk of heart disease, it turns out that measuring telomere length is actually as good, if not a better measurement or a predictor of when someone should do some kind of intervention. Another simple intervention, and you've heard this talked about by I think every presenter so far when they've talked about inflammation, omega-3 supplements. People who took omega-3 supplements, fish oils, for 4 months, they actually increased their telomere length. Omega-3s change the fatty acid balance, reduce inflammation, actually have an effect on this part of our genes. So we're modifying our telomeres on the genes by fish oil. Powerful stuff. You can buy fish oil, almost anywhere. You can eat salmon. You can eat, wild freshwater fish, and you can lengthen your telomeres. Chinese tea consumption is associated with longer telomeres, at least in elderly Chinese men. A study done about 4 years ago. So drinking Chinese tea. So we're in Beijing, we're in China. The air is bad. I took this picture. It causes oxidative stress that damages our telomeres. It ages the cells. So what can we do? Okay. We talk about intervention. We talked about elimination diets. We've talked about omega-3s. We've talked about various, bromelain and quercetin, lots of substances. But I want to suggest a few simple things that we can do living in Beijing. Everybody here needs a mask. You absolutely need to wear a mask when you go outside. That was our air quality measurements the other day. Hazardous. Protection recommended. Okay? It's been that way for the past 2 months. You know, you're doing all these things for your health, watching your diet, maybe exercising, maybe taking supplements, maybe taking prescription drugs. Every time you walk outside, you're exposing your body to an incredible load of oxidative stress and your patients. So, as Dr. Hyman mentioned, one of the simple, effective things to do when he sees his patients is to do this elimination diet, and it works fantastically for people. One of the simple, effective things that you can do with your patients here in Beijing is get them to buy a mask to wear outside. It looks funny, okay? It looks different, but it's going to look funnier if they die 5 years earlier. If you live in Beijing all your life expectancy is reduced by 5 years. It's very significant. You probably saw the newspaper articles 3 weeks ago when we had that really bad spate of pollution, that living in Beijing last year, the pollution we were exposed to was worse than if you lived in an airport smoking lounge. So who here would choose to live in an airport smoking lounge? Well, living in Beijing is worse. So we're not going to change the air, this month. It will change over time, but not this month. So I recommend a mask. And then, equally as important, the air inside these buildings is almost the same as the air outside. It's almost as bad as outside. We have portable devices that we use to measure air quality. And just to give you an example, today, with the device that we use, the air quality outside is probably what we would, a 30,000 measurement, okay? Inside this building, in this room, is probably 20,000. It should be less than 100. With air filters in your apartment or your patient's apartment or your office, okay, you can get it down to under 1,000. So, a very simple tool to use to reduce your exposure to probably the thing that's causing the most health problems for any of us here, is the air that we breathe every day. Another intervention, a simple one in your practice that you can use with your patients, is intravenous glutathione. Oral glutathione, the master scavenger of free radicals, so oral glutathione, a good supplement. But if you can do intravenous glutathione once a week with your patients, much better. 1,500 units IV over about 25 minutes is great protection for all of us who live in Beijing. Smoking causes telomere shortening, amongst a whole host of other diseases, right? But part of the reason that smokers die earlier is because the telomeres are getting shorter. So all your patient education programs that you can do to reduce your patients, to have them stop smoking, will make a giant difference in their life. It's not exactly clear why, but physical activity actually is linked with longer telomeres. And people with a sedentary lifestyle who don't exercise as much have short telomeres. So, as part of what we would call a positive lifestyle change, having people start an exercise program. In this case, the study was done with 30 minutes a day of just, brisk walking. Besides it having an effect on weight, besides having an effect on our mental attitude, it also has a very positive effect on reducing the shortening of telomeres. Again, another very simple thing to motivate your patients to do to get them to add to their daily life. You've heard Dr. Hyman and maybe others talk about in China over the past 10, 15 years, as there's been more of a Western influence in China, the diet has changed and obesity has increased. And of course, type 2 diabetes has increased. obesity is related to telomere shortening. So again, why do people get sick when they're obese? A whole range of reasons. Why they die younger? Related to telomere length. I'm mentioning all these things because these are tools that you can use to help inspire patients to make changes. Again, it's been mentioned a couple of times. It's one thing to know something, and you can tell your patient. I mean, they probably know they shouldn't be smoking. They probably know they shouldn't be overweight. They probably know they should exercise. So our job as a physician in functional medicine becomes a lot bigger than just saying, here, do this. Because they're not going to do it. Most people aren't going to do it. We have to say, here, do this, and this is why, and become inspirational and motivational in how we work with our patients. And then, as has been mentioned, we then have to follow up in a week, in a month, with our staff, or ourselves, in 3 months. Are they doing the things that we've suggested? If they're not, they're probably not going to get better. And if we care about them, we can put that extra effort into helping to monitor their changes, helping to make sure they're doing the things, and find out why they're not doing them. You know, they're having difficulty finding the particular foods that we recommended, or they're having difficulty in some other way following our advice. So it's not just checking up on them, it's really trying to inquire about how can I help you accomplish the goals that we've mutually decided upon. People with insulin resistance and metabolic syndrome, okay, obviously coincides with obesity, coincides with short telomeres. So as we can get insulin under control, and you'll be learning this week a whole range of interventions for getting insulin under control, you can change the oxidative stress and change the acceleration of telomere shortening. So we really have two goals. We want to reduce the rate of shortening, and we also want to attempt to lengthen. The first one is easier than the second one, but we certainly want to reduce the rate of shortening. Big problem in China, big problem around the world, our exposure to environmental toxins. They shorten your telomeres rapidly. So how are we exposed to it? Well, in China, other countries, of course, the farm workers are exposed to it. It gets sprayed on the crops, and they're busy spraying. And here are pictures, recent pictures in China. You know, they're not wearing any protection. They're spraying. He's wearing something, but probably not doing anything. Okay. So they're getting exposed. If she gets pregnant, as was just mentioned, her baby inside the womb is getting exposed to those toxins. So before the child is born, they already have telomere shortening starting to happen. We get exposed, if we're not farmers, obviously by what we eat. In some countries in the West, organic farming and organic food produce is become readily available. In China, it's just now becoming readily available, but we as consumers can help accelerate that by asking for it, by asking a supermarket for it, by searching which markets are selling organic produce, and then buying from them to make them successful. So China can then catch up to other countries in having much more organic produce and foods available. Linked to osteoarthritis. Again, a study was done with people of osteoarthritic knees. They had short telomeres. And interestingly, the closer we went to the damaged knee, to the damaged joint, the telomeres got shorter and shorter. And it actually appeared to lead to the fact of why that joint, those cells, couldn't repair itself. Again, the cells are replicating, right? They're duplicating, so our body has a very wonderful system to repair itself. In the case of people with osteoarthritis in the knee, short telomeres were preventing the normal process of repair and replication properly. So the knee couldn't repair itself. It's related to infertility. We actually can measure telomere length and predict fragmentation after in vitro fertilization. So we can predict which IVF won't work. And by association, the same would be in normal fertilization. So a woman who has short telomeres, who's been exposed to the things that reduce it, has a higher chance of a non-pregnancy. So the kind of summation of what I'm saying of this part of the talk is lifestyle and nutritional habits, as well as stress, genes, the expression of your genes, all influence these short telomeres and how fast we age. An inflammatory diet, and I think she's eating all the foods that would qualify for that, shortens telomeres. It increases oxidative stress. So refined carbohydrates, fast foods, processed foods. All the faculty have talked about processed foods and the various reasons to avoid eating them. A very key reason is they create oxidative stress, which shorten your telomeres, which leads to cell death, which leads to early death of us. Artificial sweeteners have been shown to do it. Trans fats, saturated fats. So as we, and I think the toolkit includes, the list of foods that aren't part of this list. So there's a whole range of healthy foods that we can eat, your patients can eat, if they pay attention and don't cause this oxidative stress. Here's the process of extending the length of a telomere. So there's actually this enzyme which, through this biochemical process, can extend it. So we want to do things that create more of this telomeres, things that increase the supply of the enzyme in our body. So far I've been talking about chronic diseases, right? Heart disease, cancer, type 2 diabetes, arthritis. What about acute conditions? I've wondered about this myself. I've been studying telomeres for about probably 15 years, and I've wondered about what about acute conditions. A study just came out last week in the Journal of the American Medical Association for the first time that implicated telomere length in the common cold. So people who had short telomeres were more apt to get a common cold. And the study authors actually said that telomere length is a stable marker of disease susceptibility, and they're associated with the disease and clinical outcomes. So not only do the people who have the short telomeres have increased risk of getting the cold, but those that got a cold, those who had longer telomeres, got over the cold quicker. So people who had short telomeres, the cold lasted a longer time. And it's very, very profound. And I can hypothesize and say that that probably applies to a lot of acute conditions. You've heard a lot so far about food. I know you'll be hearing a lot more about food and eating healthy. We've talked about omega-3s as one thing, but there are a lot of various nutrients that influence your length of the telomeres and influence the cellular function. And we've mentioned inflammation, oxidative stress, DNA integrity, DNA methylation. All these biochemical processes can be affected by the nutrients, the phytochemicals, in our food or not in our food. So, I forget who it was that talked about calories. There's empty calories and there's rich calories. So, we can eat a pound of something and it can do us no good. We can eat a pound of something, of various foods that are chock full of phytonutrients. They will have a positive effect on our body besides just providing the energy from the calories for us to function and have energy. Homocysteine levels are inversely associated with telomere length. So when you reduce your homocysteine levels, which is what you'd like to do to decrease someone's risk of cardiovascular disease, you might remember, homocysteine levels are a predictor and a marker for cardiovascular disease. So as you give folate and other B supplements, vitamin B supplements, which reduces homocysteine, you may also be, at least the study suggested, you may also be decreasing the rate of telomere loss. So treating elevated homocysteine levels with some nutrients most likely decreases the rate of telomere shortening. Herbs, an important part. And actually, an herb called astragalus, which is a very common Chinese herb used in traditional Chinese medicine very often, for longevity as one of its factors, interestingly. The first gene therapy that was successful, successful for aging was the injection of an extract of astragalus. And it extended the mouse lifespan by 24%. And that triggered the telomerase production. So actually the first gene therapy study was done with an extract of a Chinese herb. So that herb is commonly available here in China. So drinking astragalus tea is probably a good thing to do. This really shows the power of nutrition and how it's all interrelated. So along the outside here are a wide list of common nutrients: calcium, folate, B3, B2, cysteine, zinc, copper, magnesium, selenium, glutathione, vitamin C, vitamin D, vitamin E. Okay? The things that are talked about all the time that should be in our bodies, that should be in our foods. They all influence the telomeres on DNA. B3, it slows telomere attrition by reducing reactive oxygen species. B2, B6, B12, necessary for DNA methylation. Zinc, important for repair of DNA. Copper is a cofactor of antioxidant suppression. Glutathione, obviously a key part of antioxidant defenses. Vitamin E enhances DNA repair. So all these pieces, not one thing, right? It's the balance of the healthy nutrients which make a difference. Part of functional medicine looks at, in terms of the personalized medicine aspect of it, everybody's biochemically unique. So each person's unique needs for nutrition and nutritional status needs to be evaluated. It can be evaluated starting with the simple things of the physical exam, nails, hair, tongue, skin, etc., all the way to the more sophisticated nutritional evaluations of laboratory testing. So we have a wide range of tools that will be appropriate for different patients at different times to evaluate the nutritional status. But a key factor in how we age and why we die. And it's a synergistic effect of these micronutrients. Okay? That kind of creates this complex web of interactions. And looking at the chart here, so the interactions are many. Zinc is involved in DNA damage, is involved in oxidative stress. Magnesium, DNA damage, oxidative stress, inflammation. Okay? So the pathways are different, and some of the nutrients have multiple pathways, but they either lead to or are involved in telomere length regulation, or they're involved in telomere length shortening. So again, one size doesn't fit all. It's part of what you'll be learning, and part of, as you become very proficient at this, is the evaluation of what that nutritional status is of a particular patient, and therefore how do I personalize my recommendation to them to make sure that they have the right balance of these micronutrients. So a question you might be asking is, can we measure SNPs? Can we measure telomeres? And if so, why? Well, the answer is a yes and a qualified yes. So we can measure SNPs. We can measure single nucleotide polymorphisms. The Lockheed lab measures them here in China. Why would you want to measure them? Okay. you might want to understand a patient's predisposition to a range of conditions. So with SNPs, we measure SNPs. We can tell if this patient has a predisposition towards heart disease, or to breast cancer, or to bladder cancer, or to obesity. Okay? Well, why do we care? I think we care for a couple of reasons. One, if we know someone has increased risk of something, we can let them know, and we can give them tools which they can therefore then choose, if they want, to modify and lower that risk. Remember, most of the risks that we're going to tell them about are risks that if they choose to, if they give them the right information, they can lower that risk. So I should want to know what I'm at risk at, so I can do things to modify that risk. And while it's true that we all know most of the things that we should do, it's kind of hard to do everything. It takes a lot of time to do all the things, quote, we should do for a healthier life. It takes a lot of effort and maybe a lot of money to buy all the supplements and all the right foods that the research says we should do. So I like to think of it as, how do I prioritize people's resources in terms of money and in terms of time? So for patient A, it might be better use of their money and their time to do things to lower their risk of cardiovascular disease and to take supplements that will lower that, to do certain kind of exercises that will reduce that risk. For patient B, with some other risk, it might not be their first priority to do those things from money or time point of view. They have a different priority. So it's what personalized functional medicine is. It allows you to give them an opportunity to make choices that are best for them. Because it's difficult to do everything. It's just difficult to take 55 pills a day. If that's what perhaps we all should be doing, living in Beijing with our food and air sources. But it's just a pain to do. So what is it the best thing for me to do? So that's why we would measure SNPs, okay, to help you understand the probability, the risk factors for a wide range of clinical conditions and chronic diseases. And I think Dr. Hull will probably talk more about that in his lecture on lab testing. I said a qualified yes on telomeres, and telomeres testing is not readily available yet in China. Hopefully it will be in the next 6 months to a year. And it's not really readily available in other parts of the world in an easy, economical way. There's a lab in the United States. There's a lab in Spain that does telomere testing. But expensive, not easy to do, and virtually impossible to do from China because we can't move DNA out of China. So it will be available in China in the future. There are predictions that it will be as common as cholesterol testing in the next 5 years. It's a way of understanding someone's risk of disease over time. So at Lockheed Labs, as I mentioned, and I think Dr. Hull will get into more detail on it, but they provide SNP testing for about 200 conditions, James, or about 200 conditions, okay, with a report that goes into the implications of the risk and why it's at risk and then what you can do about it. This is from just a salivary buccal swab sample, so not even from blood. Easy to do for a patient, non-invasive, very useful in terms of you developing and tailoring a program for people. And I can't read the Chinese, so I don't know what it says. Hopefully it's related to telomere testing. I mean, to SNP testing. It is. Going back to telomere testing for a second. So again, Dr. Blackburn, who I mentioned earlier, the Nobel Prize winner, said, telomere length measurements can provide valuable feedback on disease risks and potentially the change or the effects of lifestyle changes. So wouldn't it be a great tool is as we ask a patient to make these changes, 6 months later to check in and see, are the changes working? If they are, fantastic. That's great motivation for the patient to keep on eating that diet, keep on taking those supplements, keep on exercising, keep on not smoking, avoiding secondhand smoke, wearing their mask, whatever. The various things that you've done, that they're doing, that you've instructed them to do. But if it's not working, well, let's reassess, and it gives the opportunity to modify the program. So a lot of functional medicine laboratory testing, other ones included, are a useful tool to allow you to see if a program is working. If not, on a functional basis, then you can work with the patient to modify an intervention. Because after 3 months, you want to know if it's working. Telomeres also can be useful in taking all the data, crunching it together, and then we can compare someone's chronological age to their estimated biological age. So chronological age is, how many years old are you from when you were born, right? Well, you may be biologically younger or older than that age. You may have lots of chronic illness, various kinds of diseases. You might be, therefore, older than your chronological age. Or you might be 60 years old and be very vital and have lots of energy, have no diseases. You might be, therefore, have a biological age that's younger. Well, using the data from tens of thousands of telomere length measurements compared to people's health, we can actually measure someone's biological age, and it can compare it to their chronological age. Obviously, a very useful tool then over time. And again, I find that laboratory tests, and I find that talking to patients, if I can simplify it for them, they understand it much better. So if I talk about telomere length, and I'm talking about, in laboratory terms, it doesn't mean much to an average patient. But if I can talk to them about the fact that their biological age just went down from what it was 6 months ago, that they may be 60, and they were biologically 65 6 months ago, but now that they did this program, they're now biologically 55 years old. That they understand. That they can relate to. And again, going back to the more that you can motivate them to make change, to stick to their changes, the more successful the intervention will be. Again, we can chart it over time. So I just want you to remember 3 things. You can modify the expression of your genes. Telomeres are the only part of the genome that can be changed by lifestyle choices. And healthy lifestyle choices for the moment are the most powerful influence on healthy aging. So let me repeat that. Right now, with the present state of what we know about healthcare and medicine, lifestyle choices are the most powerful influence on healthy aging. Not drugs, not surgery, not any fancy devices in hospitals or in clinics. The choices we make and what we eat, what we drink, the people that we interact with, other aspects of the environment. That's the most powerful part of how well we age and how long we live. Thank you.